Hope Channel, changing lives.
And you are welcome to the consulting room. We come on your screens every Monday from 8 to 9 p.m. and we bring you all the information we have concerning your various concerns and topics concern about your health. And we do that so that you'll be able to make good healthy decisions in your life. We also do that so that we can all have an enjoyable life, because the more you know, the more you'll be able to make better decisions. Today, did you know that yesterday was the World Oral Health Day, and this month of March is basically dedicated to all of us learning about our teeth. And your face is one of the things people notice about you first, and particularly our teeth too. So if you want to know more about your teeth, I encourage you to stay with us today, as we have two very big men, two big dentists, my bosses. They are here to come and educate us all about the teeth, and all the questions that you have would be answered. Talking about the teeth, we have Dr. Oman Kwabena Amponsah-Kodia, sorry. He's a dental surgeon and an oral health advocate. He's on Facebook, Instagram, and Twitter as Dr. Kobi Dentist. He trained at the KNUST Dental School. He currently works with Excel Dental Clinic, which is at Achimota, Abofu, and he's also an old boy of Opoku Ware School. I think he's very proud of his school. And right next to him, we have Dr. Aaron Osei Esibi. He's also a dental surgeon. He trained at the University of Ghana School of Medicine and Dentistry, and he's currently in private practice at the All Smile Dental Clinics. And he's also a very proud old boy of Opoku Ware School. Today, their old school reunion. Okay, yeah, welcome to the show, doctors.
Thank you.
And dentists. So, have you been looking for good milk? Have you been looking for milk that is lactose free, that will not let you visit the washroom every time you take it? Are you looking for milk that is good for babies and is good for teenagers, for the elderly, generally good for everybody? Then I would encourage you to go for cocoa milk. It's 100% plant-based milk, and it's cholesterol free, it has no allergens, it's soya free, it has no artificial flavors or coloring, and it has no additives and preservatives. It's good for everybody, as I have stated. You can get some from all the Melcom supermarkets, Valley View shops, NS Chemist, and all the trading shops around. For enquiries and bulk purchases, you can call them on 0277 344-0180, 0277-344-0180. And Hope Channel would like to say thank you to all those who have been sending their donations. Some people do it monthly. We say God bless you. So far, the donations and the offerings and all the monies that you've been sending to Hope Channel, we have a little over 200,000 Ghana cedis, and we want to use that plus the more that you'd send to purchase an outside broadcast van. This van is going to help us so that we'll be able to send the gospel to everybody. It's our mandate to send the gospel. Wouldn't you be happy to have consulting room in your local area so that you can actually get to meet these doctors and all the other programs too that we have on Hope Channel? So we would want you to donate generously as you've been doing. And on the 9th of April this year, 2020, 2022, Hope Channel there will be an offering in all Seventh-day Adventist churches in the North Ghana Union to help us get to our goal of 400,000 Ghana cedis so that we can purchase this van. We know that you've been helping us in the past, and you're really going to help us so that we can get this van as we so desire. We'll go for a very short break, and when we come back, we'll go straight into our discussion for the day.
Cocoa dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
The Poena Laimboto Hope Channel. Hope Channel de la SDA Duma TV station. Usan kel her programs la Hobante TV Kangawa. Katartaba Ghana Tinga Opua.
Yara Sungo Hope TV, Abalala, Abachayabaskora. Virana Abara. They are the new Hope TV. And not Hope TV, I'll tell you.
Hope Channel Ghana, we are here to set the captives free, to communicate a refreshing God to a thirsty generation. Christian TV like you have never experienced. Help Hope Channel share God's good news to change lives by donating generously during the Hope Channel Offering Day on 9th April 2022 in all 70 Adventist churches in Northern Ghana Union. Donate now.
God loves a cheerful giver. God bless you.
Welcome back to the consulting room. Today we are talking all about our teeth. You see how I'm smiling beautifully. It's because I've been trying to take care of my teeth. Today I hope to learn more ways to be able to take better care of my teeth so that it will take me to my grave. I don't want to have any issues. So, doctors, yesterday and this month we've been hearing World Oral Health Day. We've been hearing a lot about teeth. What are you dentists up to? Are you trying to get all of us to smile well, or what's happening?
Okay, so to begin with, as you said, yesterday was 20th March, and then 20th March of every year. So this year, and then the previous years too, and then the years ahead, it's a day that is set aside for us to, pay particular attention to our oral health. You see, oral health sometimes, sure some years ago was sidelined, and then we were not really paying attention to our oral health. So dentists thought it wise, and then FDI, or the World Dental Federation, they thought it wise to, set a day aside for us to, pay attention to our oral health and then to oral diseases, because, as I said, we sometimes underestimate the burdens and then the challenges these diseases, bring to us. Because it's found out that these diseases bring a lot of
so by these diseases you mean things that have to do with our mouth and our teeth, the diseases?
Yes, exactly. It brings a lot of burdens and stress on world health systems, economies, and then all that. But because we usually underestimate these diseases, we don't really pay attention to. So but for the previous years, they've done a very good job, and then they've brought awareness, and then I mean it's becoming fun. It's on social media. We are all involved.
Yeah, yesterday on Instagram there were a number of people, dentists, going live, trying to teach.
Exactly. So I mean, basically that's I mean what is the World Oral Health Day is about. Yeah.
Okay. Dr. Sibe.
I think for a lot of people, once they hear dentist, they probably think about kaka. Yes, exactly. They think about extractions, but there's more to oral health than just extractions. In fact, it says that the mouth is the gateway to the body.
Yes.
So certain systemic diseases can be seen in the mouth by examination. You can look into someone's mouth and diagnose HIV. You can look into
certain systemic. What do you mean by that?
So there are oral manifestations of systemic diseases. So any systemic disease,
so anything that is in your body
could have its own manifestation in your mouth.
Manifestation meaning it can show in your mouth. It can
show in your mouth.
You see, medical school, so we want to understand you.
Yes, okay. So it can show in the mouth that this is this condition that is beginning. Either it is starting or it has reached a certain level. So if someone has HIV and you look into a patient's mouth, you might be able to tell that these pointers indicate that this person might probably might
it will
have,
draw your attention to that.
And then you would refer the patient to see the appropriate physician or surgeon. Or even diabetes, non-communicable disease like diabetes could also indicate. So it's very important that every year or every time we set aside a period where we really take particular attention on what is happening in the oral cavity as well.
Okay. As the conversation is going on about our teeth and oral health, and these dentists are giving us a lot of apple. If you have any question, if you have any contribution, if you have any suggestion to give to us, I would entreat you to send it to us on WhatsApp on 055-968-006. 055-968-006. So back to the conversation about teeth. What are some of the things that people commonly come to your clinics with concerning the teeth?
Okay, so as my brother said, see, when we talk about, I mean, most of the time, as we are, I mean, familiar with, I mean, dental caries and then gum disease.
Dental caries?
Yeah, dental caries and then, I mean, or cavities in the teeth and then
holes in the teeth.
Yes, holes in the teeth.
So that's it.
Exactly.
Okay.
And then gum disease. So they are very, I mean, they're common, I mean, disease that people, and then tooth loss. Okay, these are the three, I mean, diseases. There are other, I mean, conditions that also come, but the most common ones are what I've mentioned. I mean, dental caries, I mean, tooth loss, and then also gum disease. And then, I mean, tooth loss can be the progression of, I mean, what, I mean, I just made mention about.
So how would somebody come to the clinic? How would the person come and say, I think I have this? What are some of the signs or some of the symptoms that will show that somebody has an oral problem?
Okay, so it's very interesting to note that a lot of times the course and the progression is similar for these common diseases.
Oh, okay.
So what is going to cause you to have dental caries or gum disease or tooth loss are very similar.
Okay.
And as Dr. Amponsah said, the progression might result into one or the other. So the commonest presentation or the commonest complaint that people would have is that they have a cavity or a hole in their tooth that is hurting. That's the most common.
Even when they drink cold water, they need to kick them.
So they feel there's a shock. So once they take in something very cold or something hot, they feel some sort of discomfort or a shock. Or for some people at night, they say, Dr. Manda, and Manda cry.
Oh, teeth too can cause that.
Yeah, severe pain.
Okay.
The pain, the level of pain from toothache, it's very high. is very, very high. So that could also be another trigger, another indication of an oral health condition. There may be also bleeding when brushing. So the bleeding,
it's not normal to see. You see, some people will brush and they use so much energy. Then when they bring out the
phlegms,
yes,
because
it has some blood stains. It's not normal.
No, so normally we shouldn't even brush to the extent where we are retching and having mucus coming out. No, because that actually damages the tooth, and it's something that we'll talk about in the course of our discussion today. How hard bristled brushes and applying very hard forces during brushing can actually damage the tooth rather than help it in a good way. And then we might also have people who would complain that they've noticed their teeth are mobile and shaking. And within our cultural setting, some people feel that tooth loss is a normal transition within aging. So when you reach a certain age, it's normal for you to lose.
I don't know if you know this. I'm trying.
The adage.
Exactly. And honestly, that's not true. That's not entirely true. Because if you take good care of your oral hygiene, you can go back to the grave with all your 32 teeth intact.
Really?
Yes.
Okay.
Yes. So
that is my goal. Okay.
We should all strive for that.
So there's also this thing going around that when some people have smelly breath, they say there's a crow on its chin. Is it actually so? Halitosis, as I am told you guys, it's a very big word. Is that the cause of it? There's a sore in the person's head that is causing the person to have a bad breath.
Okay, so halitosis, as you said, or bad breath, or as we have it in in simple terms. So it refers to a person or sensing himself that the breath is not pleasant, or maybe a person close to him or her also trying to address that the person has that peculiar problem. So the cause of bad breath or halitosis, there are several causes, but most of the time about 80% of it comes from the oral cavity or from the mouth. So most of the work is done by us dentists. But about 20% or 30% too is also due to other general conditions, as we're trying to explain. You made mention of a crow trim, that thing. So it could also be as a result of chronic sinusitis or any other chronic.
I never thought of that.
Tonsillitis and other chronic ENT infections. So when the person, but because it's most of the time it comes from the oral cavity, you should see the first person you have to see is a dentist, and then when we assess you and then we realize that when we take care of the oral cavity and everything is fine, we could refer you to a different specialty for them to take over if you think that the source is not coming from our end. But most of the time it's due to poor oral hygiene and then all that. I'm sure that as we progress, as we go ahead, we will enlighten ourselves with all these things so that we can get rid of these dental diseases. Because
it's very unbearable when some people come to you and then people smell things.
So yes, that's because oral. So that's why we are trying to point. We are trying to stress the importance of oral health, because it affects a person emotionally, socially, and then the general well-being of the person, and it can even affect one's employment potential, because then it can even affect how you even relate with your spouse and then all that. So we have to take it seriously. And then for this particular World Oral Health Day, we want to draw our attention to early detection and early treatment, so that we avoid a lot of discomfort, and we should also bear in mind that once we also delay, it means that we are the cost of the treatment will also increase if we try.
I was going to come to that. It looks like dentists, people are sometimes afraid to come, not just because of the pain, but because they'll have to pay a little bit more than they are used to paying for when they have, say, malaria. Why is that so?
Usually if you come early, it's much easier to treat, and then the inputs for treatment is much minimal. So for example, if you have plaque, so plaque comes from normal food that we eat. All of us have a measure of plaque in our mouth. So once we eat, there are bacteria in our mouth that attaches the small debris of the food on the teeth and around the gum. So it is this plaque that can progress to having cavities. It is this same plaque that can give you gum disease. It is this same plaque that can give you bad breath, mouth odor. You understand? So if every 6 months you go to your dentist to have cleaning done, you wouldn't.
6 months?
Every 6 months.
Can you imagine? I've never been to the dentist my whole life.
So every 6 months. So the preventive aspect is in the long term cost effective than the curative aspect. So if it gets to a point where you have a cavity and now we have to fill, the filling would be a bit more expensive than if you had done the cleaning. Now if it gets to a point where an ordinary filling would not suffice, but would have to go in, remove the nerves, the blood vessels, do a root canal for you, it would increase the cost. Now after the root canal, we would have to put a cap on the tooth to give it strength. That will also increase the cost. For some people, after you've removed the nerve and the blood vessels and they are no longer in pain, they don't come back for the continuation. So they go and enjoy their bones and they chew and they end up breaking the tooth. Now once they break the tooth, there's an extra cost because now we cannot continue the root canal. Either we put an implant in there or we do a bridge, which would cost more. So the long-term analysis is that it's always best to see the dentist before the condition progresses further. And then other factors come into play, such as the materials that are used in the dental setting. So most of these materials are imported. And now we know how the dollar rate affects everything. So once you import something from Europe or the US or Asia sometimes, and the materials have prices that are going higher and higher, it would also ultimately translate into the cost of treatment. But as I said from the beginning, prevention is always less costly than cure. Yeah.
All right. So we are talking about going to see dentists twice yearly. How common are dentists? Yes, I happen to know dentists because we are all we have classmates who are dentists. But then there are some people that have never met a dentist before. Yeah. So how common are you people? Are you enough to serve all of us if we come twice every year? Okay.
So I mean, I'm sure the dentists in Ghana, as compared to the general practitioners, I mean, we are fewer than the general practitioners. We're about 570. The last time I checked, about 570 in active practice.
570
dentists.
Oh, that's a lot.
Yes, in active.
I thought you were like that.
I think that was the last year or so.
Okay.
Yes. But for those people, the last time I checked, for those people in active practice, but the other dentists around who are, so you can, I mean, we can match these people to the about 31 million population. Okay.
People have a lot of work to do.
Yes, but we are few, but still, I mean, the awareness still is also a problem, because that's why we are using these channels and these, I mean, Oral Health Day celebrations, just to draw our attention to the oral health, because we still, as you said, we have a lot of work to do, and then we also need to be also, I mean, dentally aware, and then sometimes to be I mean, disciplined and then compliant, because as Aaron was trying to, I mean, draw attention to certain things. Some of, I mean, most of the dental, I mean, the treatment, it's not like, I mean, prescribing a medication. Most of the things that we do are, I mean, treatments, hands-on treatment that we do. when you walk to a dentist, and then, I mean, the basic thing that he can do for you is, I mean, apart from giving you basic oral health, I mean, educations and instruction, is also do scaling and polishing, or just basic cleaning for you. Because we want to get rid of all the plaque. We want to prevent gum disease. We want to reduce, I mean, dental caries, and then prevent these advanced and then complex, I mean, dental disease. So we do. We most of the things are hands-on treatment that we do.
You do practical things.
Yes, so that we prevent, I mean, this. But we also give education and also medications too, so that, I mean, we don't let these disease progress to the point where you have to spend in more. Because if you should use like 1 CD, or let me say like $1 to, I mean, to do this preventive treatment, it's going to save you like twice of, I mean, 4 times of the amount that we are going to spend to, I mean, treat, I mean, the disease itself. Okay.
So, and then to add a little to what my colleague has said. So, actually, there's a publication that's come out recently, a research work that was done by some dentists in Accra, Dr. Sandra Hewlett and Pakwesi Blankson. And then they were looking at the determinant of good oral hygiene. So, they were looking at access and then availability of these dental services. And they realized that in a certain population, in that population in which the study was conducted, even though there was access to oral health and there was availability of oral health services, people did not patronize the dental services.
It is very true.
Yes.
So I know better. I've never seen a dentist before.
So the problem really is not about, yes, the manpower is true, because we have about 517 active practice versus 33 point something million people, and then there are not so many dental facilities around. But the reality is that, as the study has demonstrated, it looks like there's a lot of apathy towards oral health. And that's one of the things that this World Oral Health Day celebration seeks to address, because we want to work more on behavioral modification of people's attitude towards oral health. And that was what will motivate them to get better oral health. Because trust me, if there's something wrong with your oral health, your entire body will not function properly. Your confidence will not be there. A lot of things would, yes, your mental health too. Cause, and with regards to this halitosis, the mouth odor, there are people who perceive that perhaps I have a mouth odor, when in fact they do not have it at all. So we call that pseudo halitosis. So sorry, halitophobia. And then there are some people, you know, sometimes there's physiological changes. There are normal changes that if I stay at one place and I keep my mouth shut for a while, normally some mouth odor might come. So all these are challenges that border on the individual's confidence, their mental health, and their general well-being, which all come into play into their general oral health.
All right. We are enjoying the conversation so far, but we are going to go for another break. And I always tell you that our breaks are short, so we're going to go for a very short break. And when we come back, they'll teach us how to make sure that we don't get all these bad things in our mouth and on our teeth. So do well to join us when we come back from the break.
Dairy-free coconut milk. Cocoa Dairy-free coconut milk. It's a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa Dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa Dairy-free coconut milk.
All SIM cards in Ghana must be registered again with only the Ghana card. Yes, only the Ghana card.
You will not be able to make voice calls, use mobile money services, internet, and all other services linked to your SIM card if you don't.
To register, dial *404# and follow the prompts. You will be required to send the following details on your Ghana card: Ghana card number, surname, first name, date of birth, and sex.
You will then receive a special code which you will present to your nearest service provider agent or customer care center for your biometric details to be captured. Remember to add your digital address.
Dial *404# on your phone to start registering your SIM card today.
For more information, contact your service provider on 100 or the National Communications Authority on toll-free number 0800 110622. Register your SIM card to stay connected.
Come back to the consulting room, and I'm happy that you're seeing my smile, because it should encourage you to also keep good oral health so that you can give more smiles, because the more you smile, the happier you'll be, the happier everybody will be, and we'll all be happy, and it will even affect our health in a good way. So talking about keeping good oral health, toothbrushing, you see, somebody wake up in the morning with a big cup of water, go and stand outside or by some roadside, then take a whole, the toothpaste, will press like 2 meters of it, then brush the teeth, brush for like 15 or greet all the people going and come and brush for a long time, then try to remove things from the back of the throat, then we'll try to vomit some out. I'm sorry, it's a very vivid description, but then that's what actually happens.
Yes, that's what happens.
Is that how it's supposed to be?
Okay.
And if it's not, then please teach us how it's supposed to be.
So, I mean, basically, you are supposed to, the teaching or the current teaching is that we are supposed to brush for, 2 minutes. So let's say, 30 seconds for each quadrant, or each, because we can divide the jaw, the upper and lower jaw, into also half. So we have the upper left, the upper right, the lower left, and the lower right. So we are supposed to brush about 30, we are supposed to spend about 30 seconds on each quadrant, and then we are not supposed to spend so much time. And then with the size of the toothpaste, we usually recommend, okay, so let me start even with the type of toothpaste. So dentist, because our emphasis is on, prevention. So we always advocate for, toothpaste which contains fluoride, because fluoride is known to prevent cavities.
Okay.
And then, as we all know, dental caries is one of the common, dental, disease that dentists we face, and then we want to prevent. And then it's known that fluoride, prevent cavities, or it's even when cavities start, it helps to arrest the progress of dental caries. So we advise that you use a fluoride-containing toothpaste. Okay, so the other preference would be, taste, and then other, costs, and other, criteria that the person will want to look at. And then even with the size too of the toothpaste, it's recommended that you use even a pea size.
Pea size.
A pea size in our
Some
local.
of us don't know.
You don't know. Yes.
Oh, okay. That's small.
That's small.
So a pea size will be enough, because if you are supposed to use plenty, then the manufacturer will be happy with you, because he knows that you finish it and then you go and buy another one.
Some people will fill the whole toothbrush to the end and add another one.
That one is just waste, and then you don't. And then even for children especially, you don't want to expose them to a lot of fluoride. Okay, when you go to, I don't know about the supermarket and the pharmacies here, when they are, fluoride toothpaste for children, where they reduce the amount of fluoride is good, but excess fluoride too can be toxic. It can, maybe next time when we are giving the platform, we can talk about,
other,
yes. other complications that because fluoride is like a two-edged sword. It can help arrest.
Because I've heard some people actively preach against fluoride.
Yes,
sorry.
I mean there's some controversies about it, but generally most dental associations we accept fluoride, but we shouldn't also ingest. We know that the toothpaste that we use to brush, we rinse it out, we don't swallow.
No,
okay. And as I was trying to explain, for children you don't need to give them because it can be even very toxic for children. We advise that at a particular age, even when the time that you should leave them to brush their teeth should be after when they are 6.
Okay.
And then that one, even with that, they have to be under supervision. You don't want to expose them to fluoride. So fluoride is good. It prevents cavities. Get it in your toothpaste. Okay. So with the toothpaste and then the brush too. Some people may think that the harder, as my brother was trying to say, the harder you brush, the smoker's brush, it's found out that when you use the hard bristle brush, it causes damage to your teeth, and then you go back to your dentist with symptoms and of sensitivity and all that. You don't want you to go through that. So we are advised that you use a soft bristle brush, or if you want to go a little bit aggressive, because the toothpaste itself contains abrasives like rough. Something that is supposed to cleanse or clean the teeth very well. So it already contains that. So you don't need to also work hard with getting a stronger or a hard bristle brush. So soft bristle brush, and then if you want to go a bit aggressive, then the medium. So therefore the hard ones and then the smokers, we don't advise people to. Yes, so basically.
So but then people are used to these hard toothbrushes. If you tell them to use the soft one, will they still? I think it won't feel comfortable.
Yes. So just as you said, it's become a cultural thing that when you are brushing as a Ghanaian, you should be brushing.
Someone will hear you.
Someone can be 2 meters away and hear you scrubbing your teeth. So it's become a cultural thing that we need to change. But that actually causes damage, as Dr. Mponsa mentioned. So a lot of people who prefer the smoker's toothbrush feel that because it's hard and the bristles are very firm, it might probably clean the tooth better. And some people also feel that if they add a lot of muscle strength to it, they'll probably get their oral hygiene very good. But that's rather false. It's a fallacy. The technique is what is important. How you brush your teeth will determine whether you are actually cleaning it very well. There's a very simple technique that we teach, and that is brushing in circles. So when we go to kindergartens and those lower primary schools, we tell them brush in circles, flick, 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 flick. Okay,
so that's the flick, flick, flick part. I know the brush in circles.
So that's a simple way of brushing. That technique.
So the flick is what?
So you flick at an angle, so that if there are any stains in between your teeth, you get rid of it. Because if you use very hard bristle toothbrush, it causes damage to the neck of the tooth, and that's something we call cervical abrasion. So people who have that would have sensitivity, a lot of sensitivity when they are drinking cold or hot water, and that could also result in tooth loss because it makes the tooth brittle and it can break if excessive forces are applied to it. And also for children, I think when they are young, before they get to the terrible 2s and the 3s, perhaps we need to instill in them a brushing culture before they get to that age. Otherwise, a lot of parents complain that their children tend to fight them when they try to brush for them. So when they are very young, when you see the first 2 teeth appearing around the 6 months, you can probably give them this. We have these toddler toothbrushes that you can just live with them, and then they will play around with it, and it becomes part of their normal routine and their habit. And so once it gets to the serious time where you actually want to do some thorough brushing, they would be happy for you to do the cleaning for you. And then, as we mentioned, the quantity of toothpaste for children it's not the same quantity for adults.
Even adults are using pea size.
Yes,
How much more?
Exactly. So a smear, just a smear on the toothbrush could be enough. Because if you give the child high levels of fluoride, it could give them tummy ache. As a result of the high levels. But the amount of fluoride in toothpaste, the normal toothpaste, is not so high that it's toxic, that it's lethally toxic. But if you consume in high quantity, certainly you have negative.
And toothpaste are nice, so the child can easily swallow
end up. So that's why I would want parents to always supervise the brushing of their children.
Okay. I know aside toothbrushing, you've been preaching flossing. Sometimes it's a long thread. Now we have some on some with the handle that we use. How is that done? And if you are doing it, why is it good to do it?
Okay, so you see the brush, I mean, is not able to. There are very small spaces in between the teeth that the brush will not be able to go through. And even with the brush, we have interdental brushes. I mean, they are smaller brushes that we use to clean. Even with them, there might be even some limitations to brush very well. So after eating, there's a normal culture of people using toothpick to pick. And then we've realized that with the toothpick, it can result in injuring the gum. That you don't, because you don't want to cause a lot of trauma or pain to the gum whilst you are trying to get something out of your tooth. So we advise that after eating, you use a floss to floss in between the teeth. There's what we call interdental space in between the teeth. They are very tight junctions. Yes. So food particles can get lodged there, and then mind you, dental caries, there are a lot of surfaces that dental caries can result. Or like when we take the tooth has about, let's say, there has surfaces, and then in between the junction between two teeth is also a surface that dental caries can also result. So we shouldn't take such areas for granted. So we have to get rid of these plaque. As from the beginning of the show, we were made to. We got to understand that the plaque is what causes all the dental disease, from cavities to gum disease and all that. So we want to get rid of them, and then that's why we use the floss. So for convenience, some people, some companies have, as you said, they've developed these handles that will help us to, get access to, because sometimes it can be very, and then I would like to say that oral health is a practice. If you don't do it, you will struggle, and then, you may not enjoy doing it. And then as parents too, we should also be doing that, so that we will be examples to the kids, so that they can easily copy. Because if you are a parent and then you don't brush your teeth, you don't expect your children to do the same. Or if you force them, they won't do, because they copy from the parents. So we should instill these things in them, and then parents should be examples. Brush your teeth. We should all brush our teeth twice a day, and then floss at least once daily, so that we get rid of these plaque, and then these things that cause dental caries and other dental conditions.
And then to add a little to that, the flossing is very important. Sometimes when you brush, when you are eating and you are having very tough meat, it ends up getting stuck in between the spaces. And what happens, as I said, culturally, is that we take a toothpick and we end up trying to dislodge the piece of meat stuck in between the teeth. But what happens as a result is that the space in between the teeth is also a very sensitive area. It has bone, it has blood vessels. So once you are forcing the toothpick into that tiny space, you are causing damage to the bone there. So it becomes a vicious cycle. You increase the size of the hole there. Every time you chew meat, you would have meat getting stuck in there. You push the toothpick again there to try to dislodge. You increase the size of the hole further, and it continues on and on and on until you've damaged your tooth so much so that it starts shaking and it comes off. So that is why we say it is better to use a floss rather than a toothpick to remove any food debris or meat chunks that stuck in between the teeth. So when we are using the floss, it's a thin thread that is waxed on the surface. We don't just go in between straight down like this. If you do that, you would hurt the tooth. It will be as if you are cutting the space in between, like how the toothpick does. So we slide it along the surface of the tooth all the way down gently, and then we scoop. We do a scooping action, and then we bring it out, sliding along the surface of the adjacent tooth and bring it out. And that's how it flows. So if you go to your dentist for your annual checkup, you can just tell your dentist to teach you how to floss, and they'll be more than happy to show you the correct way of flossing.
Okay, all right. There's also this craze of going to clean, people going to the dentist to go and clean their teeth. Is it good? Because people do it frequently now. Well, not a lot of people, but I think people are getting aware of dentists, and they go and do that. Is it a good practice?
Okay, so I mean, the cleaning, as you are saying, so I'm sure that you want to talk about, I mean, dental cleaning, professional dental cleaning, or call it prophylaxis. So that one, it's a requirement. It's a preventive, I mean, procedure that we always have to do to prevent, I mean, this gum disease and then this periodontal disease that we don't want to, I mean, get ourselves into. So we advise that every 6 months or at least once a year, and then even that one is not cast in stone. There are some people who are prone to, I mean, or who already have gum disease or they have periodontal disease. For those people, they might need a more frequent dental checkups, and then, I mean, they may need these procedures so that we're able to arrest these disease, or I mean, prevent these disease from progressing further. Okay, so, and then I'm sure that you are trying to compare, I mean, there's this cleaning and also this whitening thing that is, I mean, trending currently, I mean, on social media and all that. So, as I said, the cleaning, or we call it scaling and polishing, it's something that we all need to get ourselves into. But for the whitening is something that is, I think a friend tried to compare the cleaning and then the whitening as, I mean, washing your car and then waxing your car. That's a colleague tried to, I mean, break it into simple terms. So washing your car, you always need to, I mean, wash your car, but waxing it is once in a while. So if you want to whiten your teeth, then, I mean, once in a while, when you have a program or something, whitening is a more aesthetic, it's a more aesthetic dentistry.
Just for the beauty of it.
Because there's this, as we are aging, there's the tendency for the teeth, or the permanent teeth has an off-white color than the milk teeth or the baby teeth. So, but some people, or I mean, because we eat a lot of, food or drinks that contains color, and then with time they stain our teeth, we want to have a better, look, or a better smile and all that, or we want to improve upon the whiteness of our teeth. Then we will need to go and then do whitening, and then get our teeth whiter for. But it's not something that needs to be done all the time. So your dentist will inform you as and when you can, so that you don't overdo it.
Okay.
So, yes.
Okay, and then to add a bit more to what he has said, so the cleaning is both preventive and then curative.
Okay.
So in the preventive aspect, perhaps you are having plaque building up now, you have not developed any gum disease, you don't have any dental caries. So once we do the regular cleaning, it will prevent you from having these conditions. Now, people who have gum disease, we call it gingivitis, but there are more advanced forms of gum disease that involves the bone which supports the tooth and the structures that hold the tooth in place, and that is called periodontitis. So people who have these conditions would have to have regular cleanings more than the average person. So the average person is supposed to have cleanings done at least twice every year. But for people who have severe gum disease, it could be as frequent as every 4 weeks.
Oh, okay.
Until we realize that the surface of the tooth is smooth and now it's good enough for normal healing to occur, where the tissues will go back to attach to the tooth and make it healthy.
Okay.
For some people too, they are predisposed to having a lot of plaque accumulating because of the arrangement of their teeth. So if you have very big spaces in between your teeth, you might have plaque getting stuck in between. Some people too have very narrow spaces, very tight spaces, and because the teeth are overlapping with each other, they end up creating crevices where food gets to pack. So I had a patient who was a child who came to see me for a filling, and then I realized that she had plaque accumulation. So I did a cleaning for her. But the dad was not too happy about it because he felt that the cleaning had been done the previous 5 months. So it's not even up to 6 months yet for us to do another cleaning. But that particular person, because of the arrangement of the teeth, predisposed her to forming more plaque and calculus than the average person. So based on the assessment that the dentist makes, he could say that you need cleaning every year, twice, or you perhaps need it done every 2 months, or the frequency will be determined by the dentist as pertaining to the need. Now, with regards to whitening, well, whitening has become a fad nowadays. It's become very fashionable. When we go to Instagram, we see celebrities with white teeth and all that, and everybody seems to want to have white teeth as well. But the fact is that the natural adult tooth is not white. It's not white. It is creamish, a bit yellow. Even depending on the race, because the black man's teeth are not as white as the white man's teeth. There are certain racial differences that factor into the shade of how white someone's tooth is. But as Doc mentioned, it's become a trend now. So yes, if you'd want to have whitening done, you'd have to make sure you go to a dentist to have it done. That's what we would recommend, so that they know how to handle the agents which we use for the whitening, and they know how to go about it, whether you need it or whether you do not need it, and how safe it would be for you to have it done. Yes, but it has become a trend now, and then we are offering such services. Okay,
so we have a couple of questions from our viewers, and I'd like us to take them before we continue. We have just a short time left. So someone says, is it good to remove a tooth? Because there's this perception that the moment you remove one, if care is not taken, you will end up removing additional ones.
Yeah, so I mean, in our presentation, we are trying to draw attention to the fact that, I mean, extraction is not only the treatment option, even for when you have severe toothache or, badly broken, tooth that is, that you are experiencing pain from. You can have irreversible pulpitis or acute apical periodontitis. That is, an advanced form of dental caries, which is, the infection has gone way to the bottom or the root of the tooth. So even with those conditions, we can do, there are other options that, treatment options, but I'm sure that most of us, we are not really enlightened about these procedures. So it's good that he's asking. So we have root canal treatment. My brother Aaron tried to, throw some light on it. So even if you have a very bad tooth, and then your dentist assess it, and then he thinks that, you can opt for a root canal, it can be done. So he was trying to also say that, when you extract your tooth, there can be some consequence. The opposing nature is such that, the opposing tooth tries to have contact. So if you extract a tooth, the opposing tooth or the tooth that faces the tooth directly will try to fill up or grow into that space, and that can cause teeth misarrangement or malocclusion, or improper arrangement of the dental formula. color of the person. So you don't want that to happen. So, and then it can, as we all know, it can also affect even how you chew and all that. So if you are walking into a dental clinic, you have to bear in mind that it's not only extraction that is the option. Well, if the tooth is very bad and then there's nothing that can be done, then we will go for an extraction. But there are other options that a person can go off.
All right. So Sewa from Koforidua also says she's been told she has bruxism. I don't know what that is.
Oh, okay. So that's probably...
And she cannot sleep in peace due to the embarrassment. And she's been to a dentist twice, but then it's not been of any help. She needs help.
Okay, so that is bruxism.
Okay, bruxism.
So in Twi, they will probably say orenism. So there are some people, when they sleep, you can hear them grinding their teeth together. And it's not a voluntary thing that they do. So what happens is that once they end up grinding their teeth that way, the surfaces of the teeth begin to wear off, and then it affects the teeth. So that's also another thing that could cause sensitivity. Now for bruxism, we usually do something we call night guard for them. So we will take a measurement of their mouth and fabricate an appliance that they will wear at night when they are going to bed, and that will prevent them from grinding their teeth together. And perhaps if they have tooth wear, they could see their dentist, and that could also be sorted out. So yes, there's treatment for bruxism. Okay. So she should talk to a dentist about it.
All right. So pacifiers and the dentition in children, does it affect it? And if yes, what should we do about it? If no, what should we do about that too? That's a question from someone. Pacifiers.
Okay. Yes.
The thing they put in the baby's mouth to soothe them.
Yes, to soothe them. Yes. So I think pacifiers could be used up till a certain age. You know, it gives the children derive a certain level of comfort from that suckling action. So once they are suckling on something, it calms them down and it makes them feel good about themselves at that young age of development. Some people too suck their thumb instead of using the pacifiers. So sometimes we could ignore this up till a certain age, but once you go past the age of 4 years and you are still sucking your thumb, then it will affect the arrangement of your tooth. You would actually end up with something we call an open bite. You end up with the front teeth opening up this way instead of being in contact with the lower teeth. So you end up having a space in there. Now for pacifiers, I think once they start taking in solid food, they should stop. They should discontinue the use of pacifiers so that it will encourage the children to eat more, and then as it remains there for long, it can in the long term affect their occlusion, the arrangement of their teeth.
Okay. The next question is from PK Safo, who is in Bechim. My question is that when should we use mouthwash instead of brushing? Again, he has a suggestion too. Brushing for 2 minutes is not convincing. So tell us to add 30 seconds to clean our tongue.
Yes, so that, I mean, the last point is very, I think we forgot to add that one. I mean, brushing of the tongue is very important because the tongue is known to, I mean, accommodate a lot of bacteria, and then it can contribute to bad breath. So the people who have bad breath should also pay attention to, I mean, brushing their tongue, because especially getting to the, I mean, the posterior third of the tongue, I mean, there are some spaces, some circles around, I mean, there which can, I mean, hide bacteria, and then these bacteria can, I mean, putrefy or decompose, I mean, the leftover food to, I mean, produce these, I mean, sulfur compounds which are very offensive. And then to the other, I mean, question is about, I mean, the brushing and then also mouthwash. So, I mean, for brushing, you cannot do away with brushing. A mechanical, I mean, action gets rid of a lot of, I mean, plaque Because these plaque, as we from the beginning of the show, we are made to understand that these plaque are the cause of a lot of dental disease, and then we want to get rid of them. So it's very important. And then so the mouthwashes or mouth rinses, they are adjuncts, they are additional antimicrobials that we put in the mouth to reduce the bacterial load and also to reduce the plaque formation. These mouthwash, they reduce the tendency of this plaque forming in the mouth. So you add it on to support the brushing. And then for the mouthwash, for those people who are hospitalized, those patients who have additional special needs people, for them it's very necessary that you add apart from helping them to brush properly, you also have to give them these rinses to reduce the bacterial load so that they don't end up getting their oral health getting worse and then all that. So we wouldn't want to go there. I'm sure our time is
our time is almost, it's even up, so we will not talk on the rest. We would have to arrange and have another show, but then concluding remarks 30 seconds.
Okay, so our concluding remark, what I would like to say is that the oral hygiene is very important. It's a very important aspect of your general well-being, and we should not neglect our oral health. Access to oral health is there. There are places where we can go and have our oral health taken care of. But if we don't make it a priority and we wait till we have problems, then it wouldn't be the best.
Okay. So yes, so oral health, our emphasis is on early detection and then early treatment. So you don't want to wait till your oral health deteriorates, because most people have dental, if I should put it, dental phobia. So we are trying to get rid of or reduce the dental phobia, but by letting people really know what really goes into dental care, or what dental care really is about. So there's no need for you to. Dentistry has evolved. If we've evolved past the old times where they were using these hammers or chisels and then all that. So technology. Currently what went into this current oral health day was to bring a lot of people, a lot of ideas on board on how to use technology and innovation, because already we've gone there. We are using digital scans and all that technology to make our work easy and simple. I'm sure that maybe next time you invite us, we talk about the braces, the aligners, and then all that, those new innovations in there. So dentistry is fun. We should get our kids involved, and then as parents we should go to the clinic, bring the children, and then they will love dentistry and they will love their dental care. Thank you very much.
Right. So we've come to the end of the show. We thank you all for watching us today. Brush your teeth twice a day, in the morning and before you go to bed, at least for 2 minutes, 30 seconds. The 30 seconds is for the thank. And make sure that you see your dentist at least twice a year. Take your children along, and we will all have beautiful smiles. So do well to join us next week at 8 p.m. Have a good evening.